I'm Carmen Renee Duarte, and I am the fourth child. I have two older brothers, an older sister. I'm here to talk about my mom. She was an only child. When she was about 10, all the German children had to become part of the Hitler Youth. So at 10, she was able to go to the Berlin Olympics. She was, I think, 14 when the war started, and just to me, that was just her stories of that. I just can't imagine as a child growing up at that time and the bombing and stuff like that. At one point, all the girls were sent to work in farms or factories, and so, that was scary, but yet she also had some adventurous times with all the kids. When she met my dad, they used to go out to clubs and dance, and I don't know. I think I had seen them as a child, dancing, and they were. My dad was a good dancer too, so they were very good. I mean, I'm sure he couldn't do anything as good as my mom, but he was a pretty good dancer. So everybody used to always tell me, "Oh, your mom and dad, they look so good together, and they dance so well." So. Yeah. So after the war, the Americans came in there, and she met my father, who was in the Air Force, and so they started dating. They had he didn't speak German, and she spoke very little English, so it was kind of. Before she came here, she was at a different home where she was able to get out and do things more. And then she started, she had a little stroke there and then couldn't do that, so we had to bring her here. At first it was all right. She seemed to adapt to this place okay. She had a few people that she communicated with and stuff, but now, and then it just started. Her health started dwindling even before the incident happened, that she, like taking care of herself and going to the bathroom, she no longer could do that,
I'd love to tell you the story about Elise. She's my hospice volunteer, and had shared with me that it was really frustrating going to Germany and being with her sister who has Alzheimer's.
Well, my sister lives in Germany, and she has Alzheimer's. And for 10, 15 years, I've been struggling to have conversations with her. She would come up with the most bizarre stories, and I would try to correct her, and then she'd get angry, and it was just around, just went on and on. And I was getting so frustrated. And then Linda had invited Sandy Perez from the Alzheimer's group to give us a lecture.
That's when I thought it would be great to bring Sandy Perez in to teach us about how to be with an Alzheimer patient, how to connect.
One of the things that I had covered, which is typical with people with dementias, is they return to their primary language, whatever language it was that they spoke as a child or learned as an infant and a child.
And I watched Elise ask Sandy questions, like, what am I supposed to do when my sister is saying all of these weird kind of things that make no sense, and she's angry, and it's not about things that are even real. And I find myself just saying, no, that's not how it is. And it just makes it worse. So Sandy just gave her some pointers along with us. And Elise ended up going back to Germany months and months later and trying those techniques, and came back to the States and visited with me and said, Linda, it works.
And I learned then that all the don'ts that you're not supposed to do, I did them all. And once I figured that out, life has been much easier talking to my sister or go visiting. And so I have a real soft spot now for Alzheimer's patients.
Yeah. it works. What she shared with us works. I had a very different connection with my sister. So that was very exciting for Elise and for me to hear. And then, months and months later, we get a patient diagnosed with Alzheimer's, and I thought of Elise. And the patient's name is Erika. And so that's when the story began, with me making contact with the family. And I said, how would you feel if we sent a volunteer out to see your mom? And the family said, I'm not so sure that's a great idea. Mom doesn't really communicate. She tosses a ball back and forth with us. We have a little toy that's on her bed rail, and we take her for walks in her wheelchair. That's about it. I'm not sure it would be a good use of the volunteers' time. And I said, well, how would it be if we just went out and assessed it and let you know if it was worthwhile or not? And she said, okay.
She was not communicating. She didn't like to be touched. She throws things. So my first meeting was, I had learned that she was German. And so I decided that I was just going to speak to her in German. And I did. And I told her my name was Elise. It's pronounced Elise in German, and she pronounced it back to me like that. And then I had brought a little bear. So I got ready, and I thought, okay, she's going to throw that at me. But so she took it and she put it on the railing of her bed and stroked it. And I thought, wow, this is really cool, And so then I asked her, I said, where are you from in Germany? And she said, Berlin. It just came out. There was no hesitation. And so I told her I was from Stuttgart and that was far away from Berlin. And she said, yeah. And so we talked a little more, asking her questions. And pretty soon she took both my hands. And I thought, oh, another wow, And she took her hand and put it against my cheek, and then took my hand and put it against her cheek. And I mean, to me, that was just so awesome. So that was my first meeting with her. Second meeting, I took a children's German songbook, and I read the title, and I would say, do you know that? And she would say, yeah or no. And when I started to sing one, she would join in. Not the whole song, but it was amazing. 4 or 5 words, that she would remember in German. So to me, it's just, I call it a God wink.
We felt moved too, that there had been a real connection with this Alzheimer patient and Elise as her hospice volunteer. We have a Dream of a Lifetime program, which is one of the few dream programs for adults in the country. And this is where we honor and celebrate the life of a hospice patient who is well enough to be able to experience that with their family and loved ones. So we've selected Erika as one of our dream recipients, and what we're looking at is this film as a living memory of her mom. And it's kind of ironic because with Alzheimer's you have impaired memory or different memories. So this is a memory that we hope will be a positive memory for the family. And we also are going to have a little party out at the facility with the patient's favorite Hawaiian flowers. And the family will be there, and some of the photographs the family are putting together as a collage. So this is the dream. It's creating a lasting memory for the family, a good experience we hope for Erika, to let them know that we care about them and we want to celebrate and remember them in a way that we hope will be a lasting memory for them.
What you just saw was a perfect example of what North Bay Healthcare's hospice department does for a patient. It is so impactful. What the family feels from this and what the patient feels from this is just totally rewarding. And it just extends this person's quality of life to the family for future time.